personal protective equipment and following all protocols to the T, Environmental Health Department officials got to work. In all, 6 instead of 8 bodies were buried after 2 of the families failed to show up. 5 bodies were collected from the Greater Accra Regional Hospital and another from the Ga East Hospital, all buried at the Awodome cemetery.
So which you are holding? What are you taking the rope? Left. Professional to hold the rope. Hello. Hello. Come and hold this one. Who's this? Okay. All right, go.
Director of the Environmental Health Department, Joseph Asetanga, explained the process.
As the protocols demand, when the person passes on and we are informed that the person dies, immediately the person will come to record his body in our office. Then we start the process from there. Bear in mind, the law do not permit us to give the bodies to the family members. So when the person passes on, we tell him, we do a match of counseling to the person that this is a pandemic, and therefore the pandemic is handled by the government. So we have to handle the body. But we'll do everything possible to help lay the person to rest. So from there, at the mortuary level, the bodies are kept at a different section within the normal bodies. So when the day for burial is coming, we go there, we disinfect the whole area. And the bodies we are taking, we do disinfection. We disinfect the vehicle, the hairs that come, the coffin, even the grave, we do. The people who are to do the handling are adequately protected with the PPEs. You, the media people, before you have access to come and join the program, we must protect you. Yes, and then the burial is what we are doing now. We finished laying them, we are doing the covering. After the covering, when we finish all, disinfection will take place again before we leave this place.
But some grieving relatives of the deceased who later got access to the cemetery were still doubting their relatives died from the virus. They could not hold back their tears from the pain it left behind.
Mami we say COVID na kuno. Me because COVID na kuna ka ne mana e ba be hwe wo hospital wonum ni nyina no ke wo so mo quarantine wo adan ye jan kwala ni nyina no mo asapie ene se nyina so e benya bi so ahu ti si atre wi ase na asemo yesa ya pa ya.
Yeah, sure, I think say and then 10 days.
Okay, but you understand that this is the COVID-19 burial.
Meaning when you COVID-19.
Okay, you disagree she had COVID-19. Yes. Why do you say so?
Because say onya COVID enka nipa ni ye won nchen ansa na menua ni efrem no enka yin nyina mbe isolate yen. But here lies the case. Menua no eyare mo ye no kidney kidney failure and menua ni fremu mo say mo person dey call special ward within some few hours mo say wa contradicted to COVID.
But Mr. Asetanga hopes seeing the corpses buried will send a signal that COVID-19 is real and people need to abide by the protocols.
I tell every Ghanaian that the COVID is real. So we have to rule our mind out that the COVID is not there. I always say, it doesn't pay any doctor. Doctors don't get reward for labeling any family member as a COVID body. Okay, and we are the last end of solving the problem. If the medical report don't indicate that it's COVID, we have no hand in the body.
For Joy News, Mamiesi Thompson, Awodome.